My name is Trish Ware, and I am obsessed with all things pregnancy and birth, and helping you to navigate both the practical and the magical seasons of this journey called motherhood. I'm an all-day coffee-sipping mama of 7. I've had the amazing privilege of delivering many babies in my 15-plus year career as a labor and delivery nurse and as a mama of 7. I'm here to help you take the guesswork out of childbirth so you can make the choices that are right for you and your baby. Quick note, this podcast is for educational purposes only and does not replace your medical advice. Check out our full disclaimer at the bottom of the show notes. Today, what we're going to be talking about is induction right for me. So is it right for you? Because it's not right for everyone. Is it this horribly bad thing? No, not at all. We're not going to be talking about all the specifics of induction and going up over all the ways we induce you, the medications we use, the process. That's all in the birth classes. We're going to talk about, is it right for you? And how do you decide if it's right for you? So I'm going to briefly talk about what it is and some of the reasons. And then I'm going to talk about a little bit of specifics about people who might be pushed into induction or who are more likely to hear about induction. But the first thing I want you guys to know, and I've been telling you guys all week, that I'm known as crunchy with the side of medical. So I am not like, induction is bad, inductions are horrible, it's just the devil. I'm not, because there are really legit good reasons for a labor induction and for your labor to be induced. However, many times it's not necessarily the best decision for you. However, we will support you guys if you decide that it's best for you, because that does factor into my feelings about labor induction. Someone has said, I've been told that if he doesn't come in week 38, I'll be induced in 39th week. I'm going to talk to you specifically in a minute because we're going to talk about that. And we're going to talk about different things that might be said. So, what is it? Why is it done? Medical versus elective. So an induction is just that. We're going to get your labor started. And that is by us doing some sort of intervention to start your labor. Why is it done? So there's many reasons why it's presented to a mom. There are medical reasons and there are elective reasons. So medically, maybe you have uncontrolled GDM. Now, I'm not going to say just because you have GDM, because I 100% do not believe that if you have GDM and it's controlled that you need to be induced. Another reason might be maybe your blood pressure is out of control. That can be a scary situation. So that might be a reason why your provider wants you to induce. So anytime that it is safer for baby to be outside of mom, whether it's a maternal reason or a fetal reason, then that would be a medical need for induction. Elective, on the other hand, is like maybe you're just tired of being pregnant. Or maybe your provider's going out of town, or maybe you're moving. I was actually induced because we were moving from Florida to Tennessee, and my ex-husband had to start a job at a certain time, didn't want to do it by myself, but I decided to be induced. So that was my own personal reason, and I have a right to make that decision as long as it's a healthy decision for me and baby, and it was. Back then, they did not want to induce. Since I've been a labor and delivery nurse for a very long time and having my own children, I have seen the cycle of this induction wheel. And basically, it used to be nobody would induce, then everybody was inducing. Then we clamped down and they put up some guidelines to stop all the unnecessary inductions. And then doctors started coming up with all these reasons why induction is necessary. Namely, this stupid ARRIVE study, which is absolutely bonkers. It's not a good, thorough study, but they use it to make mamas feel that if they go past 39 weeks, they're putting themselves and their baby in danger. And of course, no mom is ever going to do that, but they're lying. It's not true. Very select few is that the case. The other thing they might say is your baby is too big. That's a new one. I'm telling you, before they clamped down and had more guidelines and rules and restrictions for these providers, When I was a newer labor nurse, I didn't hear about big babies like you do now. Big baby is a thing that came up after they put so many restrictions on them. Imagine this. Back when I first became a labor nurse, everybody was inducing. They induced all the time and there was no restrictions. They just did what they want. We couldn't report them. A lot of labor and delivery nurses and charge nurses and hospitals were getting a little frustrated because we were getting more and more NICU inductions. Because imagine, if you will, the doctors are sending in a 37-weeker and she's off on her dates and the baby's really 35 weeks gestational age. They're going to go to the NICU. So we were having so many NICU inductions that restrictions were put in place. And the doctors had parameters they had to meet before they could even schedule an induction. They also had to specify, is it medical or elective? And they better damn well be able to prove it's medical. So once we started doing that, then suddenly there's all these other reasons they need to induce. The ARRIVE study comes out, which really helps them get away with it. All these different things, all these extra ultrasounds and these size, the growth measurements and blah, 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 blah. That was not a thing when I was pregnant, when I was younger. So that being said, again, if it's something you want and it's elective and it's healthy and it's safe, girl, go for it. You do what you want. You do you, and we will support you. That's something we do with our students. We support them, period. Okay, so the next thing we're going to talk about is should I? Okay. There are advantages to being induced. One, you can pick your baby's birth dates because you probably won't have, if it's your first baby, even if you're being induced on Wednesday, probably aren't going to have baby till Friday. But there are advantages to being able to decide that. Like I said, when we were moving and being able to have the baby and in time to be able to recover before I had to move. I moved when he was 9 days old, so I wasn't very recovered, but I was young and bounced back. So there also are disadvantages. Again, an advantage would be if it's healthier for baby to be outside of you, then hell yeah, thank you goodness that we have induction options. Because if it were back in the day and baby needed to come out, you would have had a C-section. So thank goodness for induction. Now, the disadvantage to the inductions are once we start intervening, it's a cascade effect and we're going to have to do more and more interventions. The other disadvantage is that induced labor does not allow you to build up those natural endorphins and those narcotics that fly, those natural narcotics that fly through your body. They don't have time to catch up sometimes. So it does feel worse in some sense. You're stuck in the hospital during those days and hours when if you were going into labor on your own, you would be going to Target, going to get food, walking around, doing your own thing, watching TV and thinking, am I in labor? Is this the real thing? I don't know. So that being said, that can really mess with your mindset when you're at the hospital for hours and hours before anything starts. You can really get worn out. So it's tiring. That's another disadvantage. The other disadvantage is it can interrupt the cycle of breastfeeding. It can cause you to have a higher risk for hemorrhage. And there's just been some studies that have shown it can affect like even your bonding with baby. Now, I've had 6 babies, 3 of which have been induced. So I'm not making anyone feel bad or anything because I had 3 inductions. I've been there, done that. So there are risks and benefits to both you and baby. Benefits would be more so if it's healthier for baby to come out of you. Okay, now we're going to talk about decisions. So you do have to sit down and you have to write out these factors that you particularly need to consider. So I've had some moms who have chosen to be induced because they struggle with massive anxiety and just the unknown of waiting for labor to begin just caused them so much angst. And you know what? We 100% support her. This is why we have the labor bat signal. And if you haven't joined my birth classes, you need to, for sure, because nowhere else will you find the labor bat signal. And Ashley can tell you, we walk through those induction decisions and the options because here's the thing. And Ashley, I wish I had Ashley on here with me today because she's our community manager and she was induced. But here's what she didn't do. She didn't say, oh, okay, so you want to induce me and what's your plan? And you're going to do this. And okay, doctor, I'll do that. No, she was like, wait a minute. I've learned a lot about induction and I would like to try blankety blank. And she led her induction. She got to have a Foley bulb. Her doctor didn't normally do that. But because she was educated and she knew her options, anybody out there want to message me, like send a chat. What do I say about options? What is my big thing about options? If you don't know the options, you don't have any. 100%. If you don't know your options, you don't have any. So I want you to really consider that. If you do not know your options, you don't have any. So this is same with induction. You need to know all the different options. And you know what? So what? If your doctor's doesn't normally do a Foley induction, so what? It's time to learn, doctor, or find another doctor or a nurse practitioner or a midwife in-house that can do it. You need to be able to navigate the plan. Your plan is not out the window. You still have options. You also want to ask questions. Go with a list of questions. We have some stuff in if you join our birth class and you get your companion ebook, you have questions to ask. So ask those questions and find out what are some different ways that we can approach this and what are the alternatives, and what if I'm okay with you doing cervical ripener, but I'd really prefer to avoid having my water broken? Or what if I'm okay with this, but not that? What can we do? What are the alternatives? What if I come in and you do cervical ripener, instead of going to Pitocin, I go to nipple stimulation, and your doctor's whatever. No, just if you don't think it works, let me try. Let's see, because it does work. I've had many of VBAC moms that going nowhere, and we switch to nipple stim and it's on game time. Okay, so the reason I wrote Induction Police, and my girls know what this is because I say it all the time on our pregnancy hangouts, which we do weekly with our students. They are not going to send out the induction police to get you if you don't want to be induced. So if your doctor is pressuring you and you know in your gut that induction is not the right path for you, they are not going to force you. They cannot force you. They can only chart that they've recommended it, right? So what I recommend, if you do not want to be induced, you do not understand and that, or you do not agree, then let's make a compromise with your provider. You can say no, but you can also navigate it the right way where there's just not as much tension. Now, if you want to just be like, hell no, sorry, that's that, I'm all for it. But what you can do on the alternatives, so let's say you have GDM or you have hypertension, but it's controlled. And they're saying, oh, well, I induce all my patients who have GDM at 37 weeks or 38 weeks, or I won't let you go, blah, blah, blah. What you can say instead is, how about this? You can say to them, your concern is for baby's well-being, correct? Yes, I want to make sure baby's okay. How about this? Instead of evicting the baby, how about I agree to come in for weekly or biweekly or whatever makes you feel comfortable? I come in and do a non-stress test, an NST, and a BPP, which is a biophysical profile, which what does that tell us? That tells us the fetal being. If their entire concern is about the baby being okay on the inside, then let's just show them that baby is. Now, let's say you agree to that. They agree to that because they know you're not going to go anywhere else, right? And you come in for one of your BPPs and your NSTs and baby doesn't pass. Guess what? You get induced because now they've shown baby's not doing well. So everybody is reassured. So I just want you to know that you do not have to get backed into a corner. Now, the power of the alternatives is there are alternatives. What we do with our labor bat signal is if we have a mama who is going to be induced or is high risk for induction, then we have her start her labor bat signal earlier than 37 weeks. So around 36 weeks. If knows she's going to be induced at 37, we'll have her started at 35. And we start doing some natural induction methods. Now, will it kickstart her labor? Probably not. But what it will do is get that cervix nice and ripe, get her body ripe, get the cervix soft, get it mushy and gushy and pliable and ready to open, ready for game time. That's one of the things we do with our students to help them prep their body. And that's one of the reasons, 100% one of the reasons why we have the labor bat signal, which I promise you, we are the only birth course that has something like this. because we want to help you navigate these twists and turns. And when you're 36 weeks and you go to the office thinking everything's kosher and, oh, when's my baby going to come? And I'm so excited for spontaneous labor. And then they tell you they want to induce you at 39 weeks. And you're like, what the living hell? You can send a labor bat signal, shine up your bat signal or what have you, and we will come to your rescue and help you navigate the confusion and the decisions, because maybe it is best for you. We don't know until we talk about it. So you have to know the benefits, you have to know the risks, you have to know the challenges of waiting for natural labor, or spontaneous labor would be my other word, is difficult. It's difficult and it can be mind-boggling. And my girls can tell you that's another good reason to have community, and why we've opened back up our student community is that we want all of you guys to have each other to be able to say, okay, all right, I'm doing it. I'm okay. I'm going to make it. Yes, I'm 40 weeks and 4 days, but I'm okay. And I've got this. And I'm going to stay on top of my mindset, because there are challenges when you decide to wait for spontaneous labor. It's not kosher always. It's hard and your body hurts and you're tired and you really want to meet this new baby. So I just want to acknowledge that, because I know a lot of people choose to be induced because they just don't want to do it anymore and they really want to meet their baby. And that is so understandable. But I also want to remind you guys that not knowing the sex of your baby and waiting for labor are some of the two last remaining surprises in our, eventually we're probably going to be able to scan ourselves and tell exactly, just scan our watch and it'll be like, oh, you're having a boy, or oh, labor's going to start in 3 days from now. So this is the last power of surprise that we have. And I feel like it's something we can revel in and enjoy and celebrate instead of being anxious about it. Hey mama, I hope you enjoyed this Facebook Live that I did during our last Fearless Birth Experience. If you know nothing about Fearless Birth Experience, go to labornursemama.com/fearless and check and see if we have one available. This is where we are going to provide you with a few free workshops. If it's live, we're going to do 5. If it's recorded, you're going to get 3. And we are going to break down some of the biggest birth fears, birth mistakes, and empower you to be excited for your birth. So go check out the link in the show notes. As always, please write a review. Say hey, say I love your podcast, and let us know what you want to hear more of, and subscribe. And again, I'll see you on Friday. Bye for now.